Now there's an editorial that is after Janta Curfew. Now we already know that on a day, 2 days or 3 days before, Mr. Modi had requested the people of India to act wisely and follow the Janta Curfew to tackle the coronavirus, that is SARS-CoV-2 and the coronavirus disease 19. 19 stands for the year 2019, and SARS is severe acute respiratory syndrome of coronavirus 2. The main motive of the Janta curfew was to bring out the behavioral changes so that people can be called for restraint and resolve when the time arises. Owing to the public health emergency, which is also substantiated by the efforts taken by WHO and the instructions issued by the WHO, it is not a new news that coronavirus is deadly. Although the fatality rate is low, but not in Italy though. It is about 9% in Italy, but overall globally it could be set as 2 to 3%. People still have to take measures to defeat this coronavirus. Now, social distancing is one of the measures that has to be taken place. Mostly, by large, it can be said that it is not an airborne disease, but various studies have proved otherwise also. That we'll see an article in the upcoming slides that says that coronavirus can sustain itself for about 3 hours in air. Now, pandemics are cruel. Well, that's not a new thing about it, but various measures have to be taken. There have been reports of migrants whose livelihoods have been hit. A large number of them live in unsanitary conditions and do not always have access to adequate water supplies. Also, there have been a mass exodus that has been witnessed in overcrowded train as virus has spread. The panic and people are thinking of moving back to their native places, at least for till the time the virus disease subsides. Similarly, on March 21, a meeting of Center's Empowered Committee for COVID-19 Response asked all hospitals to cooperate with national labs for clinical sample collection. Now, there's another article that talks about alleviating pain. Now, alleviating pain. This article is largely based or talks about the economic slowdown, which already was in India and moreover in the globe, but due to the lockdown because of the virus, this has increased tremendously. And what measures can be taken? Well, for most part, both the governments have to set apart their differences and have to work together. Both as in the central government, the union government, and the state government. The immediate pain is, of course, felt by the service industries, but as the expenditure reduces, the pain or the blow is also experienced by the manufacturing industries. Some state governments have announced measures, such as we have seen an article that informs that the UK government would be distributing 1,000 rupees in the accounts of registered laborers. Similarly, Uttar Pradesh government has announced direct cash transfer for daily wages, laborers in the construction sector, and self-employed cart owners. Delhi government has announced the provision of meals for the homeless and enhanced pensions for vulnerable socio-economic groups. And Kerala has announced a 20,000 crore financial package, of which 14,000 crore is for clearing pending arrears and rupees 500 crore is towards a health package. Therefore, Centre has formed a task force also, in which the finance minister has to or will assess the economic impact of the pandemic and suggest measures. Mostly the articles these days are related to the serious coronavirus measures and the crisis that has been affected globally. Now, no new crisis, old lessons means that we have to learn from the previous outbreaks that have been witnessed around the globe and the measures taken by them, measures taken against them. For example, India has to work on its primary care, frontline health sub centers, and primary health centers. But not only that, a human resource also plays a very important role. Trained staff should be there who can detect early outbreak investigation, counseling, basic tests can be conducted, referrals can be provided, and community health education and participation can be encouraged. Citizen engagement and mobilization for collective intersectoral action can be taken. At higher levels also there's a dearth of scientists, microbiologists that has to be filled, the gap has to be filled. Health system needs improvement and capacity building has to be done to tackle such an evolving epidemic. Similarly, there was a setting up of public health centers or public health cadres, which was recommended by the high level expert group of universal health coverage in its 2011 report to the Planning Commission. Even the National Health Policy calls for public health management cadres to be established, but as of now, only Tamil Nadu and Odisha have such cadres. I beg your pardon, this should have been ODISHA. My apologies for the spelling mistake. Well, having said that, moving ahead, the need of the hour is that countries with universal health coverage respond with efficiency and equity. Therefore, efficient health emergency providal and facilities, whether it be primary, secondary, or tertiary, is the need of the hour. South Korea, Singapore, even China has shown a tremendous improvement in the cases of coronavirus, and due to that, they have by far controlled the outbreak. The corona crisis shut down the API supply from China, which meets over 60% of India's need. Now, API is active pharmaceutical ingredients, which are basic chemicals for manufacturing medicines and also for producing more quality assured generic drugs and essential vaccine. We also need the public sector for using the compulsory license route to produce life-saving but patent restricted drug if need arises. The need to protect and promote domestic pharmaceutical security goes beyond COVID-19. Now let's talk about the another article. It is the case for laughter. In this, the author describes or points out the major importance laughter can play in improving immunity, or at least distracting the mood. For example, laughter. She points out that laughing is not a substitute for basic precautions, but laughing can help in many ways. There have been studies and books that prove this laughing thing, laughing agenda. For example, a large number of people who die following a snake bite are killed by fear and shock, not the venom in their bloodstream. Laughter as an antidote works at two levels. It can serve merely as a distraction, a form of healthy exertion. Far more importantly, it is laughter as defiance that counters fear, be it the fear of epidemic or of a tyrant. Now, previously, last week we have witnessed that a meeting was conducted among the SAARC nations in order to tackle the coronavirus outbreak. But this article, which is Test of Regional Solidarity Lies Ahead, discusses whether SAARC is revived in actual terms or it was just a drastic measure taken to tackle the coronavirus outbreak. First of all, few of the important facts here is that the last summit which took place in SARC, with respect to SARC, was in 2014 Kathmandu, and in 2016 Islamabad. This summit was cancelled because of the Uri attack, or the attack which took place in 2016. India boycotted the um, summit, and there is a clause under SARC Charter that the summit cannot be held even if single nation stays away. And since then, the group was in a limbo. India also shifted its interest from SARC towards BBIN and BIMSTEC. BBIN stands for Bangladesh, Bhutan, India, Nepal, and BIMSTEC, it is Bay of Bengal Initiative for multi-sectoral technical and economic cooperation. It was established in 1997. Its members are Bengal, Bangladesh, India, Nepal, Myanmar, Sri Lanka, and Thailand. The permanent secretariat is situated in Dhaka. Now let's talk about SARC. SARC stands for South Asian Association, South Asia Association for Regional Cooperation. Established in 1985, its members are Afghanistan, Pakistan, India, Nepal, Bangladesh, Bhutan, Myanmar, and Sri Lanka. It has 9 observer states: Australia, US, Canada. I beg your pardon, not Canada, it's China, European Union, Iran, Japan, Mauritius, Myanmar, and South Korea. Kathmandu is the secretariat. Now, is the revival really true, or there are certain problems that have to be faced even now? The author points out that, or there are different school of thoughts that believe that SARC is far from revival as of now because of the continuous problem faced in the terrorism, mainly harbored by which country, and also there has been some obstacles which have been faced mostly by India and the other countries too. Now, having said that, two major takeaways from the meeting was that India proposed to put aside $10 million for tackling this virus, and Pakistan also proposed setting up of a disease surveillance center for sharing real-time data. Now, in order to help, Delhi is also set to send $1 million of medical supplies to Nepal, Afghanistan, Sri Lanka, Bhutan, and Maldives, and similar help has been seen from China's side too. Now, this could be said that some of these countries will inevitably turn to China, since China has been taking many of the projects, such as the OBEC, One Belt One Road, OBOR also. I beg your pardon, not OBEC, it was OBOR, One Belt One Road, or the Silk Route, which China proposes to rebuild. If Modi's gestures to go some way as a part of the solution for the region, India, which will be picking up the pieces itself, must have something to offer to its South Asian neighbor 6 months to a year down the line. There should be a plan with which India can woo the neighboring nations, and demonstrate large-heartedness to all the countries of the region, irrespective of what religion its people follow. Well, only time could tell that what will happen with India and the nations of SARC relationship. The real test of Modi's leadership of South Asia, and by extension of India's, will come after the pandemic subsides, when each country has to deal with what remains of its economy. According to an infographic on Indian Express, the total confirmed cases have risen to 318,000 plus, and the death count is at around 13,672. Most of the deaths, unfortunately, are in China, but it has controlled it by far to an extent, and Italy stands at 50,000 plus, about 53,000 to be precise. China is at 81,000, and Iran and USA at 27,000, 21,000, and 27,000 respectively. Nonetheless, Spain is also at 28,000. Rest in peace for everybody. Now, there's an article that says that can vitamin C prevent coronavirus? Well, there is no evidence that vitamin C can prevent an infection, but vitamin C is good for a human body. It can help the body's immune system fight the virus if it does infect someone. But again, there is no evidence that can cure a patient either. While vitamin C is good for human body's immune system, too much of it can be harmful. The New York Times quoted Dr. Frank Esper, a pediatric infectious disease specialist, as saying that excessive vitamin C can be damaging to the stomach and kidneys. Now, there's another article that quite properly explains the stages in a pandemic. It is titled as Stage by Stage in a Pandemic. Now, first stage is when the pandemic sweeping the globe. That is, a case originates from another country and creeps into the other country. That is the stage 1. Stage 2 refers to local transmission, in which the virus has been taken from one person to the next within a locality. Now, stage 3 is a widespread of disease when there's a increase in the number of positive cases, and it can also be said that virus is now circulating in the community and can infect people with no history either of travel to affected areas or of contact with an infected person. And the stage 4, the most drastic one, is when the disease turns endemic, such as for India it is malaria and dengue. Now, these are the stages that have been globally accepted so that various measures can be taken according to the stage in which the virus is or a particular disease is. And one more article that describes that how long can virus live in air and on steam. Now, New England Journal of Medicine quite properly explains this, and some US-based scientists have conducted some experiments in laboratories that proves that coronavirus or COVID-2, SARS-CoV-2 can sustain for about 3 hours in air. But for a fact, we can say that it is pertinent to mention here that in copper it can sustain for 4 hours, and stainless steel and plastic it can stay for 3 to 4 days, and for cardboard it is 24 hours. Now, let's talk about the Spanish flu. This was a flu that occurred during the 1918. Unfortunately, at that time, the medical facilities and the entire globe was far from what it is at this present era. The medical advancements have helped us to tackle diseases more efficiently. The number of deaths during that time was about 5 crores or 50 millions. It infected although 500 million people at that time. It ranged from 1918 to 1920 December. One more article which is important is that Chennai is using waste management properly and is tackling the pollution problem. There's a scheme, or you could say there's a mechanism through which they turn the waste into ash, and then ashes are turned into pavement tiles of different colors. And last but not and among the last news which we have is that Iran leaders have refused US help, citing that there are conspiracy theory that virus was created by the USA to block the country from selling its crude oil and accessing international financial markets. And since there has been a lockdown and people are not traveling that much, airlines struggle to find parking space, and as always, markets have slumped due to the volatility in the market. This investment target is also bound to get affected. Governments have to reassess their um, policies. If not policies, they reassess their targets. Therefore, the disinvestment target was revised to 65,000 crore from the existing 1 lakh 5,000 crore, which was there for previous and for this year, financial year. And although actual 35,000 has been reported as per Department of Investment and Public Asset Management, DIPAM. Well, this was all for today's news. Let's see what comes tomorrow, and I hope that everyone is taking precautionary measures to tackle this coronavirus. Stay safe, keep studying. God bless you all.